Hello, everyone. I'm Kate Fitzgerald, and here is the panel on challenges because you've heard, 4 hours of discussion about how awesome and easy these programs are. So we've decided that we're going to inject a little bit of reality. However, since there has been so much airing of the various challenges that markets do face, I'd like to point out that the number of organizations and people around the country that intrepidly continue to do this, and I think that it's worth pausing a minute and noting, well, then it really must be meeting some substantial needs. So here we're officially going to talk about challenges, or the experts will talk about challenges, but with an emphasis also on what's been done to overcome them, or some simple and practical tweaks or policy shifts that could be instrumental in getting over the barriers that exist. Very quickly, Kate Parker will go first, representing Market Umbrella in New Orleans, and Kate has credentials. She's actually a PhD from the School of Public Health and Tropical Medicine at Tulane, and directed the New Orleans Healthy Kids and Healthy Communities program. Drew, you have already met from Michigan, and she will be presenting with Mike Basher, who is a supermarket specialist with 37 years in the food retailing industry, and he now directs the community development programs for Uplift Solutions, which is a nonprofit associated with an excellent grocery store chain in the Mid-Atlantic, Philadelphia and New Jersey. Connie Spreen from Chicago Experimental Station, which is a nonprofit that is based on Chicago's South Side and does a variety of kinds of programs connecting low-income consumers with farmers markets, both in Chicago and elsewhere in Illinois. Audet, again from the grocery store industry, he comes from a grocer family and now directs AFPD, which you heard about earlier. It's a Michigan, Indiana, and Ohio trade association of basically family grocers, independent grocers. And last but certainly not least is Sarah Burney of Wholesome Wave in Georgia. So they'll do their thing for 10 minutes each, and then we'll have time for questions.
Thank you, Kate, and thanks to all of you. It's wonderful to be here. I come from New Orleans, Louisiana, a place with lots of challenges. We've had hurricanes and oil spills, and looking forward to maybe locusts as our next challenge. So I'm here today to talk about a few things that are unique to our organization that maybe can provide some learning generally for all of us to think about. Market Umbrella was started in 1995 in the Crescent City. We run the Crescent City Farmers Market, which happens 3 times a week in 3 different locations at 3 different times of day. So communications can be an issue, but we've got that covered. Our markets are thriving and doing wonderfully. Our general mission is to cultivate the field of public markets for public good. So we consider farmers markets one of those mechanisms, but we're also interested in expansion to other types of markets and areas to address not only food access, but ways to improve and deliver social capital within the city. As you can see, we use the token system. I have some of our tokens here, which show one of our local food heroes, Jamie Shannon, and also on our left are the regular tokens that we use for credit and debit, and on the right are our EBT tokens. We believe that a token economy works well for our markets for several different reasons, one of which is that we are not a gigantic, large market with individual vendors who all have the purchasing power to provide the technology to get that done individually at this point. Maybe that can change in the future. I think that for us, the tokens also provide a tangible way for us to note what is available to shoppers when they go and have that direct intervention with that farmer. It also allows us, and this is probably one of the most important points for us, is that it makes our whole market SNAP friendly. I think that, and I don't know that this is for sure, because I started in December of last year, but my notion is that if I gave the option to all of my individual vendors, do you want to accept SNAP? I think some people would say no. So just to be realistic about that, I want to keep the market as SNAP friendly as possible. I want to make this not an option. I want to make this the rule. So I believe in having access for everyone, for all my vendors. So it's important to me that when someone comes to the market, there is nothing to distinguish them from being a SNAP purchaser using EBT or using a credit debit. I want them to feel that there is no stigma whatsoever and that they are just as welcome as another member of the community coming to buy fresh fruits and vegetables. So that's a real important distinction. We have, of course, to accept these tokens, there is definitely staffing that's needed. We began accepting SNAP and EBT in 2005, just before Katrina. Post-Katrina, we did SNAP incentives starting in 2008. There is certainly something to be said about paid and volunteer staff. Most markets that we know of across our state are not like us. They are not run with paid staff. They are run with volunteer staff. And so that is certainly a limiting factor in a challenging capacity that needs to be addressed. We also know that the technology out there is often not enough. Those systems, they're heavy, they're bulky, and can be annoying. They are suspect to weather. We have lots of that in Louisiana. But they also provide us with this opportunity to do some different kinds of outreach. And this is an example of one of our bus shelters that we have a campaign on. We do this all throughout the city. But there's other types of outreach that's really important, and that is another consideration and can be a challenge, but also an opportunity. I think it's tremendously important to do all of the things that Orrin was mentioning in terms of a multi-layered approach for directing your outreach campaign through social media, traditional media, all of the different ways you can hit at it. But for us in the South and Louisiana, what we've observed is that nothing can take the place of one-to-one interaction and one person talking to another person about the program. And that happens before they come, and when they're there, that real in-depth, how are you, what can I do for you, what can I bring you, the direct marketing that all the farmers know is what makes their profits increase and what makes the market a better place for them, really is key to making this program work. And so that takes staff time, and that takes partnerships. And as you know, it takes staff time to cultivate partnerships. Luckily in New Orleans, we're all removed by 1 degree. We all either know somebody or we're related to somebody, so it works. But I can see that can be a considerable issue in many, many different places. We go to a lot of different meetings and we talk with a lot of folks, but one of the things that I've noticed is that sometimes, even though you tell one person from an organization about your project or your program, it does not trickle throughout the organization. As much as you thought, you're like, oh, I met with them, I covered that. And then you meet another staffer and they have no idea what you're talking about. The high touch is really important. I think that can't be understated. Or overstated. So as I mentioned, we have one centralized system here with the tokens. We have one FNS number. There's a lot of training the vendors to what they can accept and what they can use. As I said, this helps us make that market completely friendly for anyone using SNAP. I think that the vendor training is certainly an issue. I think that we need more vendors in general in Louisiana. We need more small farmers. We need more mid-sized farmers. We need more people selling at our markets. We're always looking for more farmers. So getting them on board and coming in, I think, is an issue. When you have, when you have a market thriving, it's a beautiful thing, but I think it's a very delicate balance of what's there. So one of the things that we think about is the supply of what vendors can bring and what's available for people to purchase. Potentially, SNAP recipients who are used to shopping at grocery stores find everything available at all the time without regard to season or fluctuations in weather. And that just doesn't happen in real life. When people want to come to us last year and say, why aren't there so more blueberries? Where are the blueberries? We had to explain about the freeze and what that did to our vendors and why they couldn't come. There's a lot of education that has to happen at that point too. People want all types of produce at all times of the year, but that's just simply not always possible. So we let people know what's available, and we help them think about what's available, while at the same time, we try to provide technical assistance and link vendors with resources to find ways to extend their growing season, maybe through hoop houses or through whatever is possible. So supply and consumer education is a way that we sort of battle that issue or deal with that. The finance has been mentioned, the back-end finance about counting tokens, figuring out where they came from, where they go, giving out receipts. I counted I probably have a 2.5 days of one person's full-time salary just dealing with tokens in my organization. If we didn't have tokens, there would still be a person dealing with signing people up for an electronic benefit, and then there would still be administrative costs that the farmers would be incurring. So to keep it off the farmer, we incur those administrative costs because we're trying to protect the farmer from as many costs as possible. As I mentioned, there is significant outreach that's involved that our organization does. We partner with many people to help us with that, but one of the things that we've been very successful at is using our university partners to provide us with capstone students from the School of Public Health, but also with AmeriCorps students who are AmeriCorps folks who are so excited to come and do this work in Louisiana, some of which are from the area, and so they can really help with a lot of the outreach, and that's been a wonderful way for us to add capacity in that way. Our staffing, of course, we're a small organization. I have 6 full-time staff, so we work really on knowledge transfer. One thing that I've come on, creating systems is a big thing with me, protocols for everything. We have a lot of that, but we can always sharpen and tighten that up. And I think that's one thing that organizations can do to help prevent and mitigate loss when there is turnover or people leave your organization. And then finally, evaluation. That is a key part of what we do at Market Umbrella. We've piloted many tools. We've worked with many of you on all of our evaluation. And that's something we want to do more of, but that takes significant time and effort. Often it is not budgeted for. So, realizing what the fully loaded cost is of an evaluation plan, I think is an important element. And being able to utilize that in a way that's meaningful to your own organization and then also contributes to the field. The dissemination plans that I think that I've seen people coming up with are fantastic, but there needs to be more to get the good word out. The physical activity folks work in isolation. The healthy eating folks work in isolation. And it's interesting in the ways in which I think through different government agencies and partnerships at the local level, we can start to come together on that and disseminate in a more productive way. So there you have my basic 5 takeaways, I guess, about our challenges. They are listed on the left, and ways that we've worked to mitigate them are on the right. I hope that that provides some interest and excitement for you, and I'm excited to hear more about your work and listen to your questions. Thanks.
Good afternoon. I'm going to ask Elaine to help me manage my 5 minutes to talk about technology as it pertains to healthy food incentives in farmers markets. And before I do that, I want to give you an idea of the experience that I'm basing some of these recommendations on. So in the chart on the left, you can see the growth in number of farmers markets in Michigan over the last 10 plus years, and I guess this is from 2006 when we started as a farmers market association, and that's in the dark green, and then in the brown you can see the growth in number of farmers markets accepting SNAP. And so we've worked with a lot of markets to be able to help them accept SNAP and help them accept double up food bucks, and we're continuing to work with about 150 or half of the farmers markets in our state to get to that point. And so we've made a lot of progress, and we have a lot more progress to make. But over the course of those years, in the chart on the right, you can see that in the first column, we have almost half of the farmers markets in the state of Michigan are still using hardwired point-of-sale devices. These are operating at a centralized level. These are mostly our early adopters. That means in Michigan, we still have farmers markets that are running a phone line 300 350 feet across the parking lot, across the road, to get SNAP to work at our market. Farmers markets, our managers are innovative, and were using the technology that they had at that time to make it work. And they're committed to making it work. So we still have that. We have 42% of the farmers markets are using a wireless point of sale device at a centralized market table, and those wireless point of sale devices are from a number of different processors. We have a lot of third-party processors that markets are working with. We're not using just one system there. And then in the third column, the 8%, that's Kent County. Those are the farmers that have individual iPods, but just to make sure that it's clear, that's still a centralized system in the fact that the market is the one that's authorized by USDA, and they have contracts with their vendors. So it's not each individual vendor who has USDA authorization to accept SNAP. And then the 2% where the wireless point of sale devices, that's Flint. So the other wireless mobile payment pilot that we're using. And so what this means is that we have conversations every single day with our team, with our partners, about what's working in terms of technology and what's not working. And the reality is that in just a couple minutes, I don't have any ability to share with you the challenges, so I'm not going to, but I'm going to tell you what we can do about it. And this is what we need. All we need is a straightforward application, a simple contract, one cost-effective machine that we can get quickly and we can replace quickly when needed, and reliable wireless connectivity. That's all we need, right? So if you can make that happen, that's really the heart of it. And so what I want to point out here in terms of application, USDA SNAP retailer application, is that if USDA is open to some suggestions about how to revise that application so that it's straightforward for farmers markets, that'd be a huge step in the right direction. That'd help us with our recruitment, especially if we could allow farmers markets to use a business tech or organization's tax ID instead of a social security number of a volunteer market manager or a volunteer who's probably going to turn over the next year. That is something that would help us immensely. We don't need any 40-page contracts or CPAs. We need a 4-page contract that's written in plain language that farmers and farmers markets can understand, and it's possible. Xerox has it, and we're getting there. We need to be able to accept all payments on one machine. As a farmer, I want to have one machine. I don't want to we have markets that are piggybacking machines on top of phone lines, and we don't need that anymore. They need to be cost effective, and I think that this is what Rachel was alluding to before, is that we need to have solutions that make sense for vendors, whether they're getting $100 in food assistance benefit SNAP or double up over the course of a year, or $1,000 over a market day. That's a big difference, and we need to think through creative solutions that are scale appropriate and cost effective for farmers. We don't need to wait 4 to 6 weeks anymore to get equipment. We have 3 markets in Michigan right now that are waiting 4 to 6 weeks to get a machine, and it's ridiculous. And we need to get rid of that, and it doesn't have to happen that way. And we just need wireless connectivity that can support transactions in a really quick way. And I think that as soon as we can get there, it seems so simple, we're going to be in a really good place in farmers markets. And so those are a couple things that I think can happen in a farmers market setting, and I'll turn it over to Mike to talk about the retail setting.
Thanks, Kate. Good afternoon. Just wanted to address some of the challenges that are faced in the supermarket. So we were brought on by Fair Food Network, and many thanks to Aaron Hesterman and Rachel for really bringing us on board to look at the challenges kind of from a grassroots level of in the stores and figuring out all the heavy lifting that has to go on to get the project off the ground. And there's many of them. You know, determining the method of distributing the double up food bucks was a challenge and a question. Establishing the protocol for how the point of sale system is going to work and making sure that the programmers can make it actually work. One of the challenges there is even when you work with programmers and they tell you that it's going to work a certain way. It doesn't always mean that when you're trying to go live and testing it, that it really does work. So you can build a big program and find out one little step that they told you would work isn't working, and that could really throw off a lot. So a lot of the testing really needs to be done ahead of time. Training the associates on the point of sale, that's something new for them. And just tracking the redemption and the reporting of the sales through the market is very important, especially as we were talking about, Kate was talking about evaluations and how expensive that is. And our findings were it's very important for these low-income communities to have a program like this, and that's why I know you're all here today, and I'm honored to be amongst everyone this afternoon. Some of the challenges of implementation. The program used store-level gift cards. So if everyone isn't aware of that, it was a store-level gift card, which if a store doesn't have gift cards to begin with, the system works very easily. Nothing is blended with the gift card. So your reporting can just say, hey, give me the report back on the gift cards. If a store does, like most, have gift cards, then you have to be able to isolate and separate them out using numbers and tracking systems of the gift cards themselves. So having that locked down, it was very important. The gift card institutions, their capabilities, and then the creation of, as we've heard today, SNAP uses for some of the capabilities in the stores, which would be really phenomenal to have in all the markets. The report creation and data collection took a lot of time working with programmers to make sure that for Fair Food, when they needed their evaluations back and they needed to be very professional, the system had to be able to generate very methodical reports that had every bit of detail that you needed on there. So that took a lot of time to work on the creation and the data collection. Operations and training, again, these are all things that were happening grassroots at store level, being in there, working with the store managers, working with produce managers, working with associates to get everything off the ground and making sure that they really understood the program and being able to communicate that. Why are they doing the program? Why has this program been brought to their store as a pilot? And the importance of making sure that the first 3 stores that were piloted in Detroit were very successful. Office and bookkeeping training, this was probably one of the more cumbersome processes that we had to go through, because the office clerks that are doing all the everyday reporting for store sales and sales reports and all the data that they deal with, now all of a sudden they have another load of reports that they have to work on. So you have to be kind of sensitive to the stores and the owners and managers that they have to understand up front that it is more time consuming for their associates. So there are more hours going in. And I know earlier we heard a little bit about that for just the financial piece of how much it costs to run some of the programs. Some of the added challenges that I wanted to talk about was for local produce only programs. One of the problems that we found was the availability and harvesting seasons. A lot of the customers were really looking for a lot of the fruits to be out. The vegetables seemed to come out. We ran the program between July and the beginning of July and the end of October. But a lot of the redemption was kind of slowed because as we were surveying customers, why aren't you redeeming? Oh, we're waiting for the fruits to come out. We're waiting for the fruits to come out. And you know, in Michigan, sometimes they come out quickly for a week or two, and then they're gone, and then they're waiting for other fruits. So that, I think, is one of the local challenges, is the harvesting season. Further south, Louisiana might be a little different. I was in Shreveport last week working on something, so there you go for your state. So it'd be a little bit easier, but further north, it obviously creates more of a problem. Some of the local products, when they're procuring local products, don't always have a PLU code on them. So it's, again, you're trying to track data and get all the information you can. You don't want any loopholes in the system and the reporting for evaluation. UPCs and PLUs, price lookups, are usually nationally used on all the same product. So sometimes that works well and sometimes it doesn't. Identifying locally grown produce at the cash register was another thing that we had to work on. We created a double up bucks food sticker. If you see the one down there on the right-hand side, that's what got put onto all the fruits and vegetables. And that helped the cashiers kind of identify what the products were that were qualified for part of the double up bucks program. So if they spent $10 in produce, they would get an additional $10 in double up food bucks to spend on locally grown Michigan produce. So they had to bring that up front to the cashier, and there was a process the cashier had to go through for that. Marking the local produce, and then what we did to identify a lot of it, since it has the same UPC throughout the country, a lot of the stores would put a 5 in front of the regular PLU to identify it and pull the data back into the system where we could track the reporting. So that's it. Thank you very much.
Right. I'm Connie Spreen, and I do know why I am on this panel. I am the expert in not having money. So we are going to talk about the challenges of financing nutrition incentives. I'm with the Experimental Station in Chicago, and Experimental Station manages the Link Up Illinois program, which we undertook in 2011 in partnership with Wholesome Wave and the Illinois Farmers Market Association. And it really is work that came out of our own 61st Street Farmers Market, which we launched in 2008 and 2009, started double value at the market, and since have provided food stamp service, EBT service for the city of Chicago. Now this year it'll be 16 markets that we serve in addition to our own. And have had a lot of experience with seeking funding for this kind of thing. I seek funding both for my own farmers market, the 61st Street Market, but also for the Link Up Illinois markets, which has grown to a network of over 40 markets. And Link Up Illinois Experimental Station brings in the funding. We redistribute it to farmers markets around the state. Primarily that money has been private foundation money, not exclusively, but primarily. And we also provide a range of other services to the farmers markets with which we partner, including, we select the markets, we train them, we provide technical support, we teach them how to collect data, we monitor their progress, we consolidate data at the end of the year and report for the state. In the course of fundraising for the last 7 years, both for our market and for Double Value, there are some realities that I have encountered that I think have to be stated even prior to talking about double value, because they're so critical to just simply kind of bringing in the funding or realizing how a farmer's market works. Farmers markets are not money makers. They are not generally for-profit businesses. Most often they are funded by a municipality or independent markets like ours, which are funded by whatever money we can possibly bring in, including vendor fees, which is a very small percentage, about 10% of our farmers market budget. And once you add SNAP, as we've been talking about today, you add SNAP and you add double value, all of a sudden you're bringing this need for greater capacity, greater funding to be able to pay people to do that administrative component. And while I'm a proponent of FMPPs and private foundation money, bring it on, I'll take it all. But the reality is those are one-timer or two-timer or maybe three-timer grants. And those are not long-term solutions. In fact, I think what has happened is with FMPP money, also private foundation money, at least in Chicago and that area, is that there is money, there's a lot of excitement about starting new markets, particularly markets in low-income neighborhoods that have absolutely no capacity. There's no money in those low-income neighborhoods to be able to continue to fund that market. And so after 1, 2, maybe 3 years, the private foundation money flags, and the market disappears. The city of Chicago funds about 20 markets a year that they kind of operate, at which we provide EBT service. And they've been talking about letting go of their farmers markets. And I advise them not to, because unless they are in areas around the Museum of Contemporary Art, for instance, a very affluent area, they cannot support those markets. And they will disappear with all the services that come with them. That said, I will talk about the double value fundraising. The Link Up Illinois started, as I said, in 2011, coming out of our own work. And for 2 years, private foundations were really great about funding double value in Illinois. So our program grew from, 10 or 20, we were aiming for 10 markets. We had 20 markets in 2011 and 38 markets in 2012. And then that language got in the Farm Bill and about nutrition incentives. And there are so many competing interests for money in the Chicago area. We had over 400 murders, and a lot of these are youth-oriented. And so there's just tons of competing interests for money and all sorts of needs that seem much more essential than food. And so funders were very happy to say, oh, the goal, the mission of our funding was to get language in the Farm Bill. Victory, we did it. And so because there are so few occasions where they can actually claim any kind of victory in a city like Chicago, they were really happy to do so. And so they cut off funding for double value. That was in 2013. That was last year. And so we were, shocked and in a state of crisis financially. And so it created this occasion for us to go into rescue mode and began to really think, very intently about who are the real stakeholders in this. I'm only going to talk about a piece of the path that we took. There's more, so in the question and answer you can ask about that. But one of the key stakeholders that we identified in March of 2013 was the health sector. And so for approximately 14 months now, we have been very, very actively speaking to the health sector. As you can see, markets offer healthy food options, an educational and supportive environment, and it is a place where high-risk populations, at least from our experience, very willingly go on a very regular basis if we offer nutrition incentives, which we do. Our 61st Street Farmers Market matches up to $25 per cardholder per market day. So there's a great incentive. So we have been speaking to hospitals, we have been speaking to health insurance companies, we have been speaking to healthcare plans, the Illinois Hospital Association, the American Diabetes Association, American Heart Association. Everybody's game. Everybody's interested. And we're very happy to be able to report today that we are closing a deal with the largest Medicaid provider in the state of Illinois. We've been aided in this by the Affordable Care Act. Because of the ACA, I prefer to say ACA instead of ACA, but because of the ACA, we are expanding Medicaid in Illinois, and there will now be henceforth a 97.5% overlap between SNAP recipients or SNAP eligibility and Medicaid eligibility. So that's getting very close to 100%. So when you're talking about SNAP customers, you are also talking about Medicaid recipients. And so the healthcare industry, which only a year ago told us we were 10 years ahead of our time, they're catching up very fast. We have convinced them that this is in their interest for a whole host of reasons, and I won't get into all of them, but it most certainly is in their interest, at least in the state of Illinois, where we have a $2.4 billion Medicaid gap. And so we are partnering with, as well, the Illinois' largest health insurance provider, and that will hopefully close in the next week or two. In an effort to kind of help our health care providers, we partner, I should say, also with University of Chicago Medicine. We've actually developed this in the last 6 months, and this is actually 3 screens of an app that we created over the winter, and we call it Eat Up. So Eat Up is not just the app, it's also kind of an initiative that we just piloted this spring, just now in the last week, at our 61st Street Farmers Market, trying to see what we can do in terms of gathering health data at our farmers market. We have a fruit and veggie prescription program we do with the University of Chicago Medicine that doesn't, for us, that model does not work. So instead, we're moving the healthcare system to our farmers market, where people are willingly coming. And Eat Up has this app where we are able to take health metrics of our customers at the market and it's anonymously recorded within this app, and hopefully over the course of time, we will be able to get some sense as to whether our customers, by eating more fruits and vegetables, their blood pressure is hopefully decreasing, their BMI is hopefully improving, and because it's anonymous, the customers are much more willing, we've discovered already, to participate, and we do our best to make it as convivial as possible. So it is not a medical setting. They receive an incentive, an additional incentive for participating each week, and the goal then is once they find out what their blood pressure is, so you find out you have an elevated blood pressure, at the market we have information provided where we tell them, this is what's in season at the market that's really terrific for lowering blood pressure. We're actually not giving $10, we're going to start with $5 because we want to see how that does. And maybe we'll raise it back to 10. But here is some additional money to go out and purchase some of those vegetables if you'd like at the market. So we don't know if this is the long-term solution for funding for us, but it is definitely a solution, and our healthcare partners are very excited about it. So we're hoping that it will help us to bring in funding in the future. Thanks.
Good afternoon. Just a little, intro in terms of who AFPD is, because I've had a couple questions about that. AFPD actually stands for the Associated Food and Petroleum Dealers, which is a really long name and a really bad name for actually who we do, what we do, and who we represent. So we've been around since 1910. Started as the Detroit Meat Cutters Association, multi-state organization, have a little over 4,000 members, Michigan and Ohio and some surrounding states. All the way from the very big family-owned grocery stores like the Myers, $16 billion company, to your small mom and pop. Convenience stores as well and gas stations, because we see consolidation within the independent market. I want to thank you all, first of all, for including me here. I feel kind of special being the only grocery representative here. I mean, Mike works in the stores, but from a store standpoint, want to tell you grocers don't bite, okay? Most of us don't. I say that because we talked about farmers markets today so much, and I really do believe, I was talking to Orrin earlier, I really do believe that the next wave, and I think the big wave, is going to be in the grocery segment, just because of the numbers. So I want to first of all thank our partners, the Fair Food Network, Uplift Solutions, USDA. Love working with the department, with Andrea specifically, Gold. I actually have a weird role in being in front of you, so I got to share that with you a little bit. I grew up in the grocery store industry in San Diego. Age of 10 years old, started bagging groceries for my dad. Only time we could actually see him, because independents work a lot of hours. And I've been trying to run away from it ever since. In all seriousness. So I figured, let's go to school. Went to school, got my first job here in Washington, D.C., working for a local congressman, went back to law school. Figured practicing law is easier than running a grocery store, which it is, for those of you that want to open up a grocery store. And it's more lucrative. But, I was in the prosecutor's office in San Diego County, and then 2 years go by, and my dad comes to me and says, this trade put food on your table. You got to protect independents like me, so kids like you have the same ability to go to school. And so that really hit me pretty hard. So changed careers in San Diego, and then, I came to Michigan about 5.5 years ago. So I say that because you should all hook up with your statewide grocers association. But I also mention that because not all associations are made alike. Some may be very, interactive with you and want to be very aggressive on this, and some might say, not interested. When you develop it, come see me. So we kind of come with a different lens, but I always like to look at things not as a challenge, but as an opportunity, kind of just my upbringing. So a couple things I want to share with you in terms of why it's so important for Michigan, I'll say, in the Detroit area. 1 in 5 people in the state of Michigan are on food assistance, on SNAP benefits. So about 1.9 million people. In some areas like the city of Detroit, that's 70 to 80% of the populace. I know that because we have 79 grocery stores, full-line grocery stores in the city. We happen to represent about 65 of them. They've shared a lot of information with us, and I know some of their sales are 70, 80% dependent on SNAP benefits. And so if you really want to make a big impact, you got to look at certain communities, certain cities, certain demographics to really jump in with both feet. That being said, why would a grocery store, especially independent, want to be a part of this? I mean, you heard about some of the challenges. I'll kind of get to the challenges in a second from my standpoint. But what we've seen as a trend is, in higher income areas, the consumer is more prone to buy more produce, fruits and vegetables. It's a general rule. We actually know that because we've seen similar stores, same owners in the city of Detroit, and there's stores outside the city, and we've run the numbers. Lower income areas, you'll see a higher percentage of meat purchased with overall dollars. So, give you an example, a couple stores, very similar, same owners, both sides. Their Detroit store, is about 7.5% produce sales, 30% meat sales. Their sub store in the suburbs, 14% produce, 15% meat. Why is produce so important? Why is eating healthy so important? Well, as an independent operator, in a sense, we can't compete against the Krogers and Walmarts of the world when it comes to that can of green beans. The shelf life on there, they could buy, warehouses. But when you talk about commodities, perishables, produce section, the meat section, if independent's going to make it, it's going to be on those two areas. And so that's why independents really try to have a really good produce section. And the other part is numbers. The grocery store industry, very numbers oriented. Kind of mentioned you really don't want to be a grocer growing up because profit margins are 1% to 2% if you're successful. Whole Foods is kind of different. They're a different model, but even you've seen them kind of go down recently with some of their stock prices. So the produce area for most stores is between 8 to 14% of overall gross sales. So you're talking about a pretty big section of their overall sales. Average independent store will do about $1 million of sales a month. I know I have some members do $1 million a day. So, it kind of ranges from that. And also profit margin is before the shrinkage is about 40%. After shrink, it's about 32% on average. So you're talking about something that the grocers really want to sell more of because it's their livelihood. And plus, they do it really well. So those are the reasons why grocers definitely, when given the opportunity, are going to run at this program. So let's talk about some of the challenges, though. Biggest challenge, and you might laugh at this, it's new. That's the biggest challenge from the grocer standpoint. It's new. So we don't have, the solutions on POS. We don't know what to do here and there. But like anything else, I'm reminded from the farmers market model in Michigan that, the first and second year wasn't as great as it is today. So anytime you have something new, you're going to have your challenges. But like I said, those are opportunities. Also moving forward on that is the POS, which is mentioned over and over and over again. I hate to say it, that's going to become a bigger issue because the most current farm bill, the terminals aren't even being supported or paid for by the bill anymore. So now retailers are going to have to pay out of pocket just for that terminal moving forward as the implementation comes in. So POS is not going away on that issue. But if we're able to do something with some of the contractors per state, whether it's Xerox or JP Morgan, and have more of a uniformity on how this moves forward, I don't see an issue with this being seamless eventually. Because those contractors are so important. Why do I say that? Because independents, each of them have a different POS system. And the POS providers, when an independent calls them and says, I want to change this, first thing they think about is, okay, let me sell you new software. And, average retail lane is $5,000 to $10,000 per lane, upgraded every 2 to 3 years, so on and so forth. So software infrastructure is pretty costly. But if the contractors really got on this issue and they were serious about it, I think the POS issue would go away. Other issues that we saw was, and Mike mentioned it briefly, Michigan-only produce. It's great to have, but it's going to be a challenge as well because it is seasonal. And then going back to the time frame, we only had it for 4 months in the Detroit area. And by the time the consumer figured it out, the program was over. What else did I want to share with you? It really comes down to the dollars and cents. I hate to say it because going back to what we saw earlier, $16,000 were redeemed out of 3 stores over a 4-month period. Just do the math on that and see if it's worth it for a grocer today to say, hey, let's do this, and it's going to be a profit generating business. And the answer is it's not going to be. But we keep preaching to our members that this is the future, this is coming. We're a big believer in that, the carrot approach versus the stick. We've seen from some of the court cases, whether you agree with them or not, that restrictions on, SNAP is not going to go forward anytime soon. So having these initiatives in place to actually get people to act the right way, we do think is a solution. We're very proud of the partnership we have on this. We definitely think we could scale it up. One of our internal issues we have, and I was, had made Rachel nervous a little earlier today, was, I want to run on this issue. I'm thinking 100 grocers, they're knocking on my door, they want to be a part of this. And they're thinking, let's do 5 this year, maybe 20 next year. So that's internally a conflict we have, at least in Michigan, in that I have members who call me and say, how did they get it? I want to be a part of this. And that's not an easy conversation for me to have. And so we do believe if you build it, they will come from the independent sector. And once the independents do something and they build things, the chains actually follow suit a lot of times because it's competitive nature of the business. And just one thing I want to end with is AFPD has always been very involved in healthy access to foods. I kind of mentioned earlier in Michigan, one out of 5 people are on SNAP benefits. The end of 2010, early 2011, we actually entered into a private-public agreement with our DHS where we actually funded out of pocket the changing of food stamp distribution for the state of Michigan. So we came out of pocket $180,000. The state matched it to move the food stamp distribution from 7 days, 8 days to 20 days. That was at that time like, wow, what are you doing? Some of our bigger members, Meyer, Spartan Nash, who was mentioned earlier, they're like, we're not going to help you fund this all day. You're on your own. But we had enough independents that got together in 30 days, funded it, and now 7 other states have followed suit. The 6 other states are a little smarter because they didn't come out of pocket. The associations didn't. The government actually did it. But the whole point there is if there's a will, there's a way. And I really do think the challenges that are brought up here, they're not really that big in the big scheme of things. And if the energy and the information and the enthusiasm I've heard in this room, I think this is going to be a no-brainer. And that's why I keep on mentioning to Oren and Rachel, I want to run on this issue, and they're reminding me we need to walk. So thank you again for having us here today, and look forward to answering any of your questions.
Good afternoon, everyone. I'm Sarah Burney, and I was asked to speak on connecting with SNAP customers on behalf of Wholesome Wave Georgia. So first, I want to provide a really brief introduction to Wholesome Wave Georgia. To clarify that, I think everyone's I always get the confused look of, are you Wholesome Wave or Wholesome Wave Georgia? So Wholesome Wave Georgia, or Wholesome Wave was kind enough in 2009 to let us add Georgia on to the last part of their name and operate as our own nonprofit entity in Georgia. So we operate similar to Wholesome Wave with a network of close to 25 markets across the state, and our mission being to increase access to healthy, wholesome food for all Georgians. We double SNAP benefits across this network of 25 producer-only farmers markets to, number 1, increase access to and affordability of healthy foods, but number 2, to support local growers and investment in the local economy. We double up to $50 in SNAP benefits on all SNAP-eligible items per market visit. And in 2009, we doubled close to $6,000 in EBT and the coupons spent at farmers markets, and today, in 2014, we expect that number to be about $500,000. So it's really incredible what's happening in Georgia right now. We have about 150 farmers markets across the state, and of those 150 farmers markets, about 100 of them are accepting SNAP benefits. This morning before I came here, I was going to tell you that we were leading the nation with the largest amount of SNAP benefits spent at farmers markets and direct marketing farms in the nation. After speaking with Alan Hunt about that 3.8 million number, it appears that a few U.S. territories like Guam and Puerto Rico were added to that 3.8 million number, so we're actually about third or fourth in the nation. But still, it's really, it's really incredible that a state like Georgia is up at the top of that list. It's really thrilling to have a state in the South where, as you all know, things move a bit slower, up so high. So I want to speak about challenges associated with connecting with SNAP customers. We work, as I said, with a network of about 25 farmers markets, and many of those other markets that are operating in Georgia are constantly coming to us for technical assistance because we don't have a Georgia Farmers Market Association. So we hear a lot about the challenges associated with getting SNAP customers into markets. There are 6 different categories that I want to touch on briefly. First being knowledge about the program. When you sign up for SNAP, when you enroll in SNAP, you're not told that you can use your SNAP benefits at a farmer's market, nor that there's an opportunity to double those benefits by shopping at a farmer's market. Second, the affordability of food. There's this perception that food at a farmer's market is more expensive. You're not going to be able to get the value of your dollar by shopping at a farmer's market. Third, the convenience of the farmer's market. Is it walkable from the SNAP recipient's home? Is there public transportation to get there? Is it on a day where I'm working or at a time when I have to pick up my kids? Education and resources. There's knowledge associated with knowing how to prepare the foods that are sold at a farmer's market. Is it a food that may be new to the customer, or a food that the customer doesn't know why it may be important or healthy to eat? The options associated with shopping at a farmer's market. It may be a lot more convenient for someone to go to a grocery store where they can do their entire weekly shop versus going to a farmer's market where there isn't everything or less of what you could purchase compared to a grocery store. And then finally, the inclusivity, the perception that farmers markets can be exclusive and one may not feel welcome there. So staying with this same framework, I want to talk about successes and some best practices, if you will, in the Georgia context. There's so many different things that our markets and markets in other states have done that I've heard about, but these are some examples that I just want to highlight because they are really working in the Georgia context and helping bring customers into markets for the first visit and coming back. So first, like I said, the knowledge of the program, the knowledge of the opportunity to double SNAP benefits at the market. Really developing trusted relationships with community leaders, organizations, market staff is what really keeps customers coming in for that first visit and coming back again and again. Whether it's developing relationships and partnerships with large state organizations, food banks, faith-based organizations that have those relationships, they're embedded in the community and are connecting with the SNAP customers on a daily basis and can promote the Double Value Coupon program that way. Or whether it's having programs like, for example, a market ambassador. This is something that many of our markets do, where there's a market ambassador. That's the person that's swiping the EBT card each week. They're greeting the customer, they know them, they're welcoming them and chatting with them each week when they come to the market. Or sending door-to-door outreach teams that go and put a personal face and make that personal connection to the market. Those are all things that are really helping promote and spread the Double Value Coupon program in Georgia. Second, the affordability of food. So really highlighting that the coupon and incentive programs make food affordable. One of the markets that we work with made a list of 10 grocery items. And they went and did that food shop at a local grocery store, and then they did it at the market using the Double Value Coupon program. They made a little flyer out of it and then did some outreach in the community and passed that flyer out. And it showed that the food was actually a little bit less expensive using the Double Value Coupon program at farmers markets. Convenience, so partnerships with community organizations that can organize transportation to the market and possibly adding a second or third even weekly market to increase accessibility. We have one market that's doing a neat program right now where each week or each month they highlight a neighborhood surrounding the farmers market, and they really put all of their efforts into working with community organizations, churches, senior centers in that specific neighborhood for the entire month to organize shuttles to the market for that month. So they're really getting them off the ground in terms of the first initial steps of getting them in the habit of coming to the market each week. And then the next month, they highlight a different neighborhood where they, again, put all of their efforts into that one specific neighborhood and the community organizations that have the possibility of organizing shuttle services to the market each week to make it more accessible. And then we found a lot of our markets are Saturday mornings, and adding a Wednesday evening market has really helped. Or whether it's a Sunday and a Tuesday evening or something. But having a market that's in the morning and then in the evening makes it a lot more accessible for people. Education and resources. Having really fun programming at the market gets people into the market. I have so many different examples. Some of our markets have done really neat things where they have cooking demonstrations, where they have a community garden and they're taking produce from the community garden each week, doing cooking demonstrations around it, promoting and advertising those cooking demonstrations the week prior, maybe highlighting free samples and giveaways so that customers are wanting to come and do their food shop, but it also can be a fun family activity or an activity for neighborhood kids to come together and attend the market. Handing out recipe cards. One of our markets has a walking club that they're calling Walk with a Doc, where a local doctor comes and walks to the market with this group each week, and during the walk they can talk about cooking and using some of the different foods and the health benefits associated with that. Another market has funding for a pantry basics kit where on your first visit you receive, I think it's a spatula, your second visit you receive a small pan, and your third visit you receive something else. But again, all resources that are promoting cooking using the foods bought at market. And then finally, in the education piece, I want to highlight having fun education or fun activities and possibly fundraisers. The Collard Greens Cook-Off is one example. In a few weeks, we're going to have a Killer Tomato Festival and Peach-A-Palooza Festival. And these are all just fun activities that give customers and local chefs and nutritionists an excuse to come out and practice cooking the food at the market and showing customers how they may be able to use them and prepare them. Options, having lots of vendors that provide a variety of options for customers to purchase at the market. So whether it's encouraging vendors to have value-added products like jams, pickles, prepared foods that individuals can come and snack on while they're at the market. And then finally, inclusivity, having programs that really promote a feeling of inclusiveness so that customers are coming to the market not just to purchase foods, but because it's really become a community center where they feel part of the community. It's a place where they can see friends, they can see their market ambassador, for example. Many people have mentioned using a token system where credit and debit also receive tokens so that it's not just SNAP customers using tokens at the market. We also did something last year we called a SNAP challenge, where individuals that were not SNAP recipients were encouraged to live on a weekly SNAP allowance and use the double incentive program at the market. And again, that was to promote inclusivity. So to end, I just want to let you read through this slide and again highlight that it really begins with those relationships, being embedded in the community so that knowledge about the program is happening by word of mouth. Again and again I hear that. It's really the relationships and making customers feel like they want them to come to the market and shop there and be part of the community. And from there the education piece comes in. SNAP customers are learning how to prepare the foods, they're learning why it's important to eat healthy foods, and from there the habits develop. They're wanting to come back to the market each week to see their friends, to participate in the activities, and again to purchase affordable healthy food options. And that's where we're seeing the behavior change happen. And that's what we all want, right? To have SNAP customers really prioritizing healthy food and being able to use the incentive programs and shopping at farmers markets as an outlet to create the access to healthy, affordable, to create the access to and accessibility of healthy food options. And that's it.